Let's take a look at the pathway of blood through the heart. Blood traveling from the body to the heart is deoxygenated. It enters the superior and inferior vena cavas into the right atrium, moves through the tricuspid valve and into the right ventricle. From here, blood is pushed through the pulmonic valve into the left and right pulmonary arteries and to the lungs. Blood releases its CO2 for us to breathe out, and it becomes oxygenated at this point. Oxygen-rich blood travels from those lungs through the pulmonary veins and into the left atrium. It goes down the bicuspid valve into the left ventricle. And then that blood is pushed out of the aortic valve to the aorta and the rest of the body. And that, my friends, is your blood flow. Big thing to remember, the only arteries to carry oxygen-poor blood are the pulmonary arteries. Otherwise, all other arteries carry oxygen-rich blood away from the heart. And the same goes for the pulmonary veins. These are the only veins that carry oxygen-rich blood from the lungs back to the heart. Again, all other veins will carry deoxygenated blood. Guillain-Barré syndrome is an autoimmune disorder where the immune system attacks the nerves in the peripheral nervous system. This is one of those conditions that did pop up on my NCLEX, and I can confirm you do see this in real-life nursing, so let's learn about it. When we're sick, our immune system kicks into gear to attack the invading organism. In Guillain-Barré, the immune system attacks in overdrive and mistakenly attacks the myelin sheath of nerves. Think of your nerves like an electrical wire. The wires are coated in a protective layer. When that layer becomes frayed or damaged, the wires or nerves are exposed and will not work properly. The first symptom of GBS is paresthesia. Huge NCLEX tip. Symptoms are ascending, meaning it starts in the feet and moves upwards. Think GBS for a gradual block of sensation. Best NCLEX mnemonic right there. Please remember that one. Okay, so paresthesia turns into paralysis, and if not treated, this can be life-threatening, because think about it. If GBS moves upwards to vital organs causing paralysis, we're risking airway, breathing, cardiac changes, and all of that. There is no cure. It remains dormant in the body, but you can recover from these symptoms if you do the necessary interventions. And as the nurse, of course, we're watching all of these things. The rule of nines are the easiest questions to get right on the NCLEX, so let's go through it. Essentially, you can divide the body into sums of 9. The whole head is 9%, 4.5 for the front, 4.5 for the back. Each arm is 9% total. That means 4.5 for the anterior, 4.5 for the posterior. Each leg is 18%. Think about this as being twice as big as the arm, 9% for the anterior portion of the leg, and 9% for the posterior portion of the leg. The anterior trunk is 18%, and the posterior trunk is 18%, and 1% for the groin. Add all that up, and you get 100% total body surface area. So if a patient has partial thickness burns to the anterior right arm, anterior right leg, and anterior trunk, that would be 4.5 plus 9 plus 18 equaling 31.5% total body surface area burned. If the patient has burns to the anterior right leg, that's 9% only. If the patient has a circumferential burn to the right leg, circumferential meaning the whole circumference, that would be 9 plus 9 equaling 18% burned. This helps you know if the patient needs to be transferred to a burn unit, and also helps to determine the amount of fluid therapy needed within 24 hours using the Parkland burn formula. For memory tricks for insulin and the most important things you should know for administration. First, let's go over what falls under each category. To remember your 3 rapid-acting insulins, think they do not lag when it comes to lowering blood sugar. Regular insulin is the only one for short-acting, same with NPH for intermediate, and then we have 2 for long-acting. Detamir lasts all year, aka lasts a long time, and Lantus, think of a lantern that burns for a very long time. Now the only one given IV route is regular insulin. Regular insulin can be given with NPH at the same time in the same syringe. Regular insulin can be given with long-acting insulin at the same time but in different syringes. We also need to know our onset and peaks, but I will tell you rapid-acting and long-acting are the most important to recognize. Rapid-acting takes effect in 15 minutes or less, and long-acting has no peak. Being familiar with these helps us know when to eat. For example, onset is 15 minutes or less with rapid, so we can pretty much eat at the same time. And then we have some general rules. Biggest thing we watch for are symptoms of hypoglycemia, and as the nurse and for your NCLEX, it's important to know how to treat this. Classic memory trick right here. Now, if the patient is awake, we give them candy, juice, or low-fat milk, and if the patient is unconscious, we give them IV D50. Many drugs in pharmacology will act on alpha and beta receptors. I'm about to show you a trick to make pharmacology studying way more simple. 1 is for heart because we have 1 heart. 2 is for lungs because we have 2 lungs. 1 will constrict, 2 will dilate. A for alpha receptors is also A for arteries, and we're talking mainly in the smooth muscle. B for beta receptors is also B for beats or breaths because beta 1 works on the heart or heartbeats, and beta 2 works on the 2 lungs or breaths. In our sympathetic nervous system, beta 1 receptors constrict vessels in the heart, which causes increased heart rate and force of those beats. Take epinephrine that has beta 1 agonist properties. Now, beta 2 receptors dilate the bronchioles in the lungs. If a patient has asthma and we give albuterol, a beta 2 agonist, to stimulate the function of beta 2, 2 means 2 lungs, 2 also means dilate, so we're dilating the lungs for asthma patients. Now, I saved alpha for last because this one can go off the memory trick for some alpha drugs. We say 1 for 1 heart because it does constrict the arteries in the heart, but it can also constrict smooth muscles in various places in the body. Prazosin, an alpha-1 antagonist, is typically used for BPH, but can also be used for hypertension. Remember, antagonist means doing the opposite of normal, so that's why it can be used to relieve constriction on the heart and/or the bladder.